Hi, my name's Keith Scott Mumby. I'm an alternative MD. And over the years I've treated tens of thousands of patients, many of whom had cancer, using largely alternative strategies. I'd just like to talk to you for a few minutes about cancer. Statistics have now reached the proportion where 1 in 2 men and almost that many women are going to get cancer at some time in their lifetime. So my motto, "We're all battling cancer," really does have meaning. It means, statistically speaking, either you or someone very close to you is going to get this disease. So you need to listen up. And it's very unwise to wait until the day when you get that knee-shaking diagnosis to actually begin to explore the possibilities. No time is too soon, and now is a very good time to find out what the alternatives and options are. You see, there are many ways of tackling cancer. Radiation and chemotherapy and surgery that's sometimes, let's face it, rather brutal, are only some of the options. These are considered the proper treatments or the official treatments, but of course that's the story that comes from doctors and the medical profession who actually stand to gain a lot of money using those methods. They're not really very interested in the fact that these methods don't actually work very well. The actual results are very poor. They nevertheless go on peddling these strategies as the proper way to treat things. Well, you know, it's been said that it's easier to treat cancer, at least in the early stages, than it is to treat a common cold. I mean, hey, we can't do anything about the common cold, but you can do a lot about cancer in the early stages. And in this short series of videos, I'm going to introduce you to some very crucial things that you can do that could make a big difference. Now, I'm not even trying to talk you out of chemotherapy and radiation. If you want to do that, that's fine, and a lot of my patients chose that option, but they came to me for alternative backup. Because you see, what happens if you take the time and trouble to protect your body, to go in for good nutrition, to go in for alternative health strategies, you can prepare your body for the worst of the onslaught. And what actually happened is that most of my patients didn't get the nasty side effects of chemotherapy. Over a 10-year period, not one of them that I can recall even lost their hair. So you can look at these as standalone therapies or combined therapies, and don't be put off by what the oncologists tell you, that you mustn't do these things, or if you take vitamins, that means the chemotherapy won't work. This is all unscientific bunk. And I've told you the whole story in my Super E report. It's called Cancer Confidential. If you're ready at this stage, you can go and download yourself a copy and enjoy what you read. But if you want to know more, I'm going to do a short series of videos. The first 3 will introduce what I call my 3 pillars of health. This is really the 3 main ways of tackling cancer. If you do one of these, you're going to improve the chances dramatically in your favor. 2 of them, you're looking good. And if you put all 3 successfully in place, then I think you could be almost guaranteed that you're going to survive the cancer. Cancer cures these days are so common, they're everywhere. You'd have to make a deliberate effort not to see them. It's not such a difficult disease to beat, but you have to know what you're doing. You have to know what your options are. You have to know the different resources and different approaches. And I can help you with that. Thanks very much for listening.